Autonomic dysreflexia. This is an NCLEX tip that you don't want to miss. So if you're prepping for NCLEX and studying for the NCLEX exam, you need to watch this video. So this is going to be our tip number 2, and this would be autonomic dysreflexia. So what is autonomic dysreflexia? So autonomic dysreflexia is a life-threatening it's a life-threatening emergency in patients with spinal cord injury above the level of T6. So that's your thoracic number 6. So they're going to be specifying this in your NCLEX exam. So they're not going to say the injury is in T6, or they're not going to say that the patient has spinal cord injury at T10. So it should be higher than T6. So meaning to say it's going to be injury from T5. So you're going to have injury T4, T3, T1, and then you have your cervical, which starts in cervical 8. So anything that is in the cervical spinal area and anything from T5 to T1, this is what they're going to be talking about when it comes to a spinal cord injury. That means it's autonomic dysreflexia. Okay, so a couple of things to know about this. So what's happening in this autonomic dysreflexia is something below the injury, so meaning to say below T6. There are triggers, and injury below the T6 are considered triggers to what we call massive. It's going to be a very massive sympathetic responses. So meaning to say your signs and symptoms are going to be related to the sympathetic nervous system. So remember that sympathetic nervous system that we learned in nursing school, right? Flight or fight, right? Remember that? So those are the symptoms that you're gonna see. So these are the classic triggers. So a couple of triggers that's causing the autonomic dysreflexia. More often, it's going to be bladder distension. You can see bowel impaction as well. So what are the clinical features that you're going to be seeing in this particular patient? So you're going to have severe hypertension, you're going to have pounding headache, and then you're going to have what we call sweating above the injury level. So these are the 3 things that you're going to be looking for when you're looking at autonomic dysreflexia. The priority intervention, y'all, is very simple. And so this is what usually trips many students, is that they tend to choose the kind of like loosen the clothing or cutting the clothes and everything like that. But the priority that you really need to know for this particular exam in your NCLEX exam is this. The priority is put the patient or sit the patient upright. And the reason why we sit the patient upright is we want to reduce that blood pressure. Remember, your blood pressure here is going to be very high, like 180 over 90 or 190 over 100. It's really gonna be high, right? It's not gonna be like moderately high, but it's really gonna be very high. So the first thing that you really need to do, this is it. Place the patient upright so that you can reduce the blood pressure. And then, of course, the next thing would be to treat the cause, right? So remember, most of the causes I mentioned, bladder distension or bowel impaction. So bladder distension, Foley catheterization. For bladder impaction, of course, digital extraction, right? To get rid of the impaction in there, right? And so then the third choice would be the loosening of the clothing. So that's So more than likely, a lot of the students would choose number 3, but the correct answer, if they're asking for the priority, would be putting the patient upright in a sitting position so that you can lower the blood pressure. So the other thing to also take into consideration, so if they're going to use this as a case study, they're probably going to go further into like what is the health teaching. So in terms of the health teaching, these are the things that you really need to look for. So telling the patient regular bladder and bowel program. So that would be the health teaching that you're gonna see. Another thing that you're gonna see would be avoiding tight clothings. That would be another teaching that you're gonna see. So remember, y'all, for autonomic dysreflexia. So there is a spinal cord injury above T6, and then you have hypertension equals autonomic dysreflexia. So again, if you're taking your NCLEX soon, save this video for later and watch this like a week before your exam. Like and follow and subscribe. Thank you so much.